I'm Ann Niedermayer, your midwife today, and I'm here to do the assessment of your baby. And today I'm assessing a 40-week gestation baby girl born by spontaneous natural vaginal delivery. And so looking overall at the infant state, I see that she is calm, she's satiated, she just nursed, and so she seems to be in a good state to do an assessment. Her tone is good. It is not flaccid and it's not hypertonic. She's got nice flexion like the nice newborn state has with her arms and legs just flexed a little bit. Overall, her color looks wonderful. She looks appropriate for her ethnicity. I don't see any cracking or peeling or skin rashes, so that looks good. Her color overall is great. I don't see any cyanosis in her mouth or nose or face. Overall nice and pink, warm and dry. A little bit of acrocyanosis in the hands and feet, but that will resolve within about a day. No concerns there. If we look at her head, I see that it's nice and round. Maybe a little bit of overriding with those sutures. That will resolve as well. I don't see any capic secundarium, no concerns for cephalic hematoma, and I also don't see any bruising, no cuts or scratches or bumps or masses. That looks good. Her hair is distributed evenly. I'm just feeling around for those sutures. I feel the coronal suture here, the sagittal suture, and then the lambdoidal suture here, and the metopic suture in front. Her fontanelles, the anterior fontanelle is nice and flat, not bounding. Nice and soft, same with the posterior fontanelle, no concerns there. Looking at her eyes, I see that her palpebral fissures are nice, evenly spaced, symmetrical. We've got those nice thirds going on, straight across, kind of appropriate for her ethnicity. Her sclera are nice and white. I don't see yellowness or any concerns with capillary bleeding. Her conjunctiva look good, things are moist. There's no drainage or lesions in her eyes. And then her nose is symmetrical, her nares are patent. There's no nasal flaring as well. She looks to be respirating well, so I'm not concerned with any blockages. No masses or lesions coming from her nares. Also her lungs look nice, or her chest looks nice and symmetrical. I don't see any retraction, so this also tells me that she's breathing well and perfusing well. If we look at her ears on both sides, we'll see that we have that nice line coming from the palpebral line down to the top of her pinna. We see that helix well formed. We also see a nice central line here, so her ears aren't set too low or too high. Tragus looks good, no pits, no crevices, lesions. They both look well formed. Looking at her lips, we see that they are nice and evenly formed and symmetrical. No cleft lip. If I take my gloved hand and slip a finger in there, I can assess for her hard and soft palate, which both feel great. I can also look into her oral mucosa and look at her gums and see that they are moist, pink, and then assessing her sucking, and then also her rooting reflex. That's cranial nerve 10. Her tongue wrapping around my finger, that's her cranial nerve 12. Also when she cries, I can see her tongue go up and down. I see her frenulum, it's unrestricted. And then her uvula goes up and down, and that's her cranial nerve 10, and then cranial nerve 9 is her swallow reflex, which I did hear and feel her swallow when I was assessing her sucking. Moving down into her neck, I see that her trachea is nice and centrally placed. Things are symmetrical, no masses when I palpate, no webbing, that all looks good there. Her clavicles are not, I feel that they're patent. There's no crepitus. I don't hear any strange sounds or clicking. She's not showing any pain with that. And then her arms, if I just look at that moral reflex, I can just give her a little drop like that, and her arms would reflex out and then back in. I can also kind of lift her this way and assess like that. And then looking at her pulses, you can feel her brachial pulse, and that looks wonderful. I can check an arm recoil by bringing her arms up like flexed like this and holding them for a minute, letting them come down, and she should recoil back up like that. And then looking at her square window, I would bring those fingers out and then push her hand down towards her forearm, and the more flexion we get there would be a sign of a younger gestation. Hers is appropriate for her age of 40 weeks. And then looking at her hands and her palms, I see many creases, not just one solid across, so that looks good. If we just had the one solid across, it could be associated with something like a Down syndrome. She has 5 digits on each hand, no webbing, no extra digits, and then I can assess for her palmar grasp, which she is grasping around my hands, so that is wonderful. No concerns with her humerus for fractures. She's not showing any signs of pain. Looking at her scarf sign, I would bring this arm across and her elbow would come midline for her gestational age. If it went further, that would be a sign of a lesser gestational age. Looking at her chest, we saw that it was symmetrical. I feel her breast buds there. She has 2 nipples, no extra, no less. We saw that there was no retractions. And then looking at her abdomen, overall, I see no sign of hernia. Her umbilical cord is clamped and drying. It doesn't have any drainage or sign of infection. Things are looking good there. No hernia down in the groin area as well. I'm going to listen, auscultate with my stethoscope. I'm going to do her lungs and heart and abdominal sounds all at the same time while I have my stethoscope out. So starting with her lungs, I would listen on each lobe, listening for those sounds. Sometimes we hear a little bit of wet, crackles as they're newborn, but hers sound great. Listening to her heart, I hear starting with the atria and then the pulmonic, Erb's point, and then tricuspid and mitral valves. I can also listen with my bell to hear deeper sounds and different types of sounds with that. Things sound great. Bowel sounds across all 4 quadrants. I hear that they're present. And then I can lift her and just listen on the back for her lungs as well. Again, across all the lobes, and things sound nice. I would do that for about a minute as well. I'm going to go back and reassess her cranial reflex too. Looking at her eyes, I could shade them so we could maybe get those pupils open, and then taking my ophthalmoscope, I would look in and look for that red reflex. That looks good. And now I'm going to palpate her abdomen, starting just shallow, going across all the quadrants, feeling for lumps or masses, and then I can go deeper and see if she's showing any signs of pain, feeling anything deeper there. I can assess for any kidney, swelling, liver, and then also her spleen, which I don't feel any swelling in those areas, so that is good. I can move into her groin, and I see her labia majora is appropriate. It is not fused. It has a little bit of swelling, which is normal for birth. And then if I want to assess her perineum, I can just make sure things look good in there. No vaginal skin tags, no hymenal skin tags, maybe a little bit of discharge, which is normal. Again, things are patent there. Looking at her rectum, I see that that is open and patent, and I've also had word that she's been urinating and stooling, so that looks good. Moving into her legs, let's see, let's do this Alice sign, and we put her palms or her feet down, and then look at the symmetry and height of her knees, which are the same. Then I can check for any hip dislocation and stability. So I would do the ortonalis maneuver going out like this, and then the Barlow's maneuver coming back like this. No clicking, no clunks. That all sounds good. I could do the popliteal angle and just bringing her thigh up against her abdomen and seeing how far the angle goes as I push her ear or her foot towards her ear. The wider that angle, the younger gestation. Hers is about appropriate at that 90 degrees. Her femoral pulses are both present and not bounding, but appropriate. Looking at her feet, we've got nice creases in her the plantar creases, appropriate for her age. Assessing, putting my thumbs up in there for her plantar grasp, which is present, and then the Babinski reflex, I would go up along the outside of each foot, and those toes would flare out. And then looking at her toes, I do see there are 5 on each foot. No webbing, no extra digits. So good news there. Let's see. Then we want to look at your back. And we're looking at her spine is nice and straight. Again, no webbing in the neck, no birthmarks around where we see a lot on the head or neck, and also on that sacral area. We might see a Mongolian spot for some ethnicities. Looking at the truncal reflex, she would wiggle side to side, and then also her gluteal folds, if I were to just lay her nicely, are even and symmetrical. Her sacrum, there's no dimple, no tuft. I don't see any sign of fistula or spina bifida. Things look wonderful there. Looks like your baby is checking out just perfect. Thank you for letting me do your assessment, and I hope you all have a great day.